healthcare system has been dominating headlines in recent weeks following the December death of a man in an Edmonton emergency department. In part 3 of our series on the issues facing healthcare, a closer look at the backlog in hospitals, which has been a problem for years.
It very easily could have been me.
Sandra Epp, among many, struck by the story of 44-year-old Prashant Srikumar, who died in an Edmonton ER last month. Epp had a similar experience to Srikumar. She rushed to the Grey-Nuns Hospital with chest pains in 2023.
My legs were actually quite wobbly when I got in, so I kind of collapsed into a chair that was right at the door. And a volunteer came and asked if I was okay, and I said, no, I think I might be having a heart attack.
She says the volunteer got her a wheelchair and pushed her to the front of the triage line. They did an ECG, and she says she was told it was fine, but she should still see a doctor.
And then we sat and we waited for hours. I just assumed I was being overly dramatic.
She says about 7 hours after she arrived, a cardiologist told her they suspected a small heart attack, but couldn't confirm it because her blood work wasn't back. She says it took another 2 hours to receive treatment after getting results from 2 blood tests.
I ended up having 2 stents put in my heart.
She can't help but wonder how much damage was done in the hours spent waiting. The ER waiting room, she says, saw very little movement that day.
It was just very backed up.
A report released last year found Albertans are spending longer in ERs than they were 5 years ago. In the Edmonton zone, the median stay was close to 6 hours, the highest of all zones. One of the reasons for that is a lack of beds. Alberta health data provided to CTV News shows, as of August, before the cold and flu season, every hospital in the Edmonton area was either nearing or surpassing 100% capacity. The Misericordia and U of A hospitals were both at 109%. The data also shows hundreds of beds taken up by alternate level of care, or ALC patients. These are patients who do not require hospital-level care and are waiting for a more appropriate place to go.
So it's a flow system problem. And if we can discharge people from the hospital 24 hours a day, 7 days a week, we can provide safer care in emergency.
The August data shows these patients took up between 18 and 37% of beds in Edmonton's 4 major hospitals. A 2024 analysis pegs the daily cost of caring for one of these individuals in hospital at between $700 and $1,200 a day. In comparison, it states long-term care costs around $250 a day. And it says the majority of these patients are seniors.
It's a hard thing to think about, and nobody wants to talk about what they're going to do for themselves when they can't take care of themselves, because they always figure we can muck through. But then something happens, and it's usually a fall, a break.
Irene Martin-Lindsay's organization represents senior and community housing providers. She says these supports were not ready for our recent growth in population.
We don't have the right spaces in the right communities.
She's been advocating for 24/7 home care and supportive living, and more spaces for people with complex needs.
Because we are seeing a lot of people that have way more than just standard health needs of, aging or even dementia or wayfinding. It is significant, complex, chronic needs and behavioral issues that are really hard to manage in a congregate setting.
She says transfers have been happening faster since Assisted Living Alberta became operational in September. The minister in charge of the new health division says in that time in Edmonton, the number of ALC patients has gone down 22%.
Officials have made clear this is the most communication they've ever seen through these divisions ever. We've been laser focused since we took over, and we've seen some of the best results on that issue in the history of the province.
And the minister is promising a minimum of 1,500 new continuing care beds every year for the next 10 years, operating funds included. He says the province's goal is that all ALCs are discharged from hospital within 30 days.